you practice on each other in class? And he was like, yeah, we do. You basically break each other and then fix each other, right?
I hope you don't turn into Jeffrey Dahmer.
We're not that bad. But I mean, one day maybe.
Not so dark. Do you have underwear on?
Is that real?
That's a real thing.
Hey, what's up, you guys? So, welcome back to my channel. If you haven't already, please subscribe. I was just explaining off camera that I have run a podcast before. If you haven't listened to it, please check out With Purpose by Scarlett on Spotify and Apple Play. There are 2 series on there already. So my first series has 8 episodes about my journey over weight loss, and there's some amazing top tips in there. So we are around the 11th of December today, and if you're thinking that you're going to be heading into a weight loss journey in January, Series 1 on Spotify is going to be brilliant for you. Series 2 moved into more of a prep diaries when I was bodybuilding. So every week I would check in with my coach, take my photos, do my posing practice, weigh myself, go and do an in-body scan, check body fat percentage, and then I would give a bit more substance to all of that by doing a podcast episode on how I felt, how my body was performing or not performing in some episodes, and things like that. Then I stopped doing the podcast. I think I did one podcast episode at the end of that when I just started Strong Woman and phased out of bodybuilding. And just really because life got hectic, I was too busy, couldn't find the space, and I don't know, no really other excuse. But I'm really excited to start this back up as part of my YouTube channel, and I'm gonna be hosting, I don't know if that's the right word, interviewing, talking to. I don't like interviewing, it's too formal. We're just gonna have a chat with different people who are part of my journey into Strong Woman and see how you can help the viewers, how I can help the viewers, bringing you in. I don't know, maybe it's not all about help, maybe it's just for fun and information and a bit of a laugh. So we'll see how this goes. Welcome to episode 1, series 3 of my podcast, although this is more like a YouTube series. So, welcome, Dr. Ranen. He is guest number 1. Do you feel privileged to be my number 1 guest?
Highly privileged.
And I was just explaining that I'm not doing a studio for this podcast, which seems to be the in thing to do, is to hire a studio and do your podcast. But I think everybody will just be more comfortable, as I just said, in their natural habitat to...
Keeping it less formal.
Yeah, just to have a chat. Just to have a chit chat and keep it friendly. So, Dr. Ranen, I'm going to do a brief intro and then you're going to jump in and correct anything that I say wrong. Dr. Ranen is from South Africa.
Correct.
Educated in South Africa.
Yes, I am.
Lives in Dubai, works in Dubai, practices only here at Physio One now?
Only here at Physio One, correct.
Yeah, so although I've seen you at different clinics, you're only here now. Do you want to introduce yourself further and tell them a little bit about yourself?
Yeah, sure. So I qualified in 2016 with a master's degree in chiropractic, and then I went into private practice. Well, maybe I should start here. What got me into chiropractic was I had a disc injury, a lumbar disc injury at 14 while playing rugby. It went undiagnosed for about 2 years, and then I started to get sciatic pain, and orthopedics and physios couldn't really help me. They were more or less telling me it was muscular, like it was a hamstring strain, etc. And then I saw a chiropractor. He did the workup, told me it was a disc injury, and once we started addressing that, I became much better. I couldn't go back to playing rugby, and obviously I lost 2 years, and I just decided that this would be my path. So I enrolled in the Chiropractic College in Durban in 2009, qualified in 2016, took the scenic route through university, went into private practice, and then 2017 I did my international certificate in ICCSP, Internationally Certified Chiropractic Sport Practitioner.
Okay.
It's a chiropractic diploma offered by the International Federation of Chiropractic Sports. It's more to allow you to have a qualification that allows you to practice at the Olympic Games, World Games, that type of event, so they know that you have a reasonably good standard. I wasn't comfortable with the direction chiropractic was heading in or is in South Africa, or just how we practice. When it comes to certain injuries, we're told you need to refer. You need to refer to an ortho, you need to refer to a neuro. And I wasn't comfortable because I thought, like, as a chiropractor, you should know how to manage certain injuries, like rotator cuff tears, disc injuries, you should know how to manage it. So in 2018, I went over to Mauritius and I did what I call my orthopedic fellowship. I worked as part of an orthopedic team, and that's where I really cut my teeth. I was seeing like 80 to 100 patients a week.
80 to 100 a week?
Yeah. I was seeing, sometimes I was seeing 20 disc patients in one day.
I didn't know Mauritius was that big.
Well, it's 1 million people, but we were only 8 chiropractors.
Okay.
And the community is very conservative, so no one wants surgery, and to get good quality healthcare is pretty hard. It's a developing country. And we were really busy. My mentor had a really good really good reputation, sets a really high standard. So we were really busy, and I saw lots of interesting cases. So and then COVID hit. Mauritius was kind of landlocked, nowhere to go. So I decided in 2021 to move to Dubai, and here we are.
And I met you in, what is it now, 2023?
Yeah, we met last year
2022,
after the strong
August.
Middle East Strongest, yes.
That's right, August 2020. Okay, so you were fairly fresh then.
Yes.
And I just wanted to add in there, a conversation we've had in another session is I asked Dr. Ranen, how do you train to become a chiropractor? I don't know if you remember this conversation. And I asked you, how do you learn to do the cracking and the manipulation? Is it as simple as you practice on each other in class? And he was like, yeah, we do. We basically break each other and then fix each other, right?
For 6 years, that's, after 4th year, you get into clinic and you start to do your clinical hours. So you're actually working on patients, but for the most part of it, you're working on each other.
So did anybody do anything wrong to you in training?
No one did anything wrong to me, but people start to get like hypermobility syndromes because, you're being adjusted like multiple times during the week. Eventually it gets to a point where the lecturers are like, okay, just set up the adjustment and then don't do the thrust, just set it up so you feel like it's going to pop.
Yeah.
And that's where you get to. But we also do a lot of community service events. Running is massive in South Africa. So we had all the marathons that are in Durban. The Comrades Marathon is a big one. It's an ultra marathon. So so at some of these events, you're seeing hundreds, if not thousands of people. So you also get to practice.
Lots of hands-on experience.
Yeah.
Cool. Thank you for that intro. So we met at a competition last summer where I competed in Dubai in the Middle East Strongest. I actually competed in the open category that time, not the under 64 lightweight category. Yes. My coach at the time was calling me Scarlett the Giant Slayer, and I didn't really hurt myself, but obviously after every competition you feel a bit, broken. And it was after trying to lift the stone onto a platform that was far too high for such a small person that I did feel that I'd done my back in. And I just came in to see you, and that was that, wasn't it? The rest is history. We are now great friends. Anyway, so we're going to go through some different topics today. First of all, we're going to talk about demystifying the chiropractic care, I think is the right word. Because obviously there's lots of myths around chiropractic care, why people might not want to come, why they're scared of coming and things like that. Then we're going to talk about chiropractic care for women specifically, because that's who I work with. And there's a couple of topics that I know you want to touch on, and I have a few things to ask you too. But also for athletes, so chiropractic care for athletes, and chiropractic care for the Gen Pop. So just your normal people doing normal things, not crazy, silly athletes like me, and not specifically just women's issues, although it could be a woman without a specific woman problem, if that makes sense. So let's dive straight into it. I want to ask you, number one, how does chiropractic care work? And what are common misconceptions that you know of? And can you demyth them for us?
Chiropractic is a advancement of bone setting. So prior to the medical community or medical fraternity developing orthopedics or orthopedic medicine, bone setting was a primary way for patients to have their bones reset. These were kind of your mystical people in your community,
like spiritual healers.
Yeah, almost,
I'm all into that.
That's kind of the roots, the foundations, osteopathy and bone setting. And then you have Dr. Palmer, who invented chiropractic or came up with chiropractic. He was kind of a magnetic healer, spiritualist, philosopher, and he basically used concepts of osteopathy and bone setting to come up with chiropractic technique. Chiropractic essentially is built on a philosophy. It's only a theory of practice, okay? It hasn't been scientifically proven, that's why we do a lot of research, but essentially it's a philosophy. The initial philosophy of chiropractic, or one of them, which I think covers pretty much all of it, is the safety pin theory. Now, in a safety pin, you know what a safety pin is, right? I'm sure all you guys know what a safety pin is. The theory of chiropractic, or philosophy of how chiropractic works, is if you take a safety pin and you unhook it, that safety pin is open. Now, you know, in Chinese medicine, they say your body has chi, right? Energy.
Like a loop cycle.
Yes. Yeah. So when that safety pin is open, there's no energy that's flowing in your body, or it's not flowing as it should. And when you close that safety pin, you have better flow of energy through the system. Now, the story goes that Dr. Palmer basically manipulated someone's neck who was deaf, and this person regained their hearing. And
like just like that?
Just like that,
and
yeah.
Then he could hear.
And basically the philosophy he came up with was these little joints that hold the spine together. They are called, the medical term is zygopophyseal joints, but we refer to them as your facet joints, okay? These joints can go out of alignment. So if you look at the spine moves in rotation, it moves in lateral flexion, it moves in extension. So this is kind of hard for me to show, but it moves in extension, and then it moves in flexion as well. These little joints can become jammed, or what we refer to as subluxed, where it gets stuck in a position and it doesn't move. Because of the joint's close proximity to the nerve, okay, the theory is that a joint that's malaligned is going to affect the nerve supply, or the ability of the nerve to send innervation to whatever. So a long time ago, if you walked into a chiropractor's office, you would see a chart, and in the chart it would show the spine, and it will show all the spinal nerves and how they connect to all your organs and all your extremities, and basically all your vital organs, right? And the theory was that if you unjam this joint, or if you realign or reset this joint, you're going to improve nerve supply. So that is where chiropractic essentially came from. Okay, how the manipulation works is that in this joint you have a joint capsule, all right, and when you start setting the patient up for manipulation and you take that joint all the way through range of motion, the fluid that's in the joint moves into the space that you've created. And when you actually perform the adjustment and that pop occurs, you don't need the pop to occur for a successful adjustment to occur. But when you actually perform that adjustment, there are tiny nerve receptors within that joint that get stimulated, which give feedback to the nerve root, which ultimately gives feedback to the spinal cord, and hence
creates a better loop of communication from brain to muscle to brain.
That was essentially the initial concept of chiropractic. Now,
I'm all about this, by the way.
Yes.
I do a lot of, sorry to interrupt you, maybe I need to not interrupt. I do a lot of yoga, meditation, sound healing. So it's all along a similar kind of path of energy flow. People often talk to me about my energy and where do I get all my energy from.
Too much energy.
Possibly, maybe that's what they talk about. Maybe it's because I see you too often, I don't know. But obviously I have my sports massage, which again increases blood flow. Blood flow increases oxygen supply to everything. As we've discussed this before in my own sessions anyway. And I do remember once you manipulated me and I literally was hysterical laughing, and you were like, are you okay? But again, I deeply believe in the energy flow and the chakras and meditation and things like this. And I know when I work with my yoga teacher who also does sound healing and meditation work, it's all the same kind of unlocking blockages through stretching and mobility and creating more space within the body. So all of it basically kind of adds up. So maybe that's why I'm such a positive ray of light.
Yes. Your safety pin is closed.
And trust me, you know when my safety pin is not closed.
Yeah.
Because my positive ray of light turns quite dark. I am a Gemini.
I hope you don't turn into Jeffrey Dahmer.
We're not that bad. But I mean, one day maybe.
Not so dark.
If I'm pushed hard enough, maybe I would. Okay, that's really, honestly, insightful to me. I wasn't aware of some of those things that you said, even though I come here often. Maybe I should have done more research before I came to see you. Okay, so let's talk about demystifying the practice.
Yeah, so where do I start? I think that creating energy balance, it has its place within medicine. Mm-hmm. But when we start talking about more serious injuries, sports injuries like tendon ruptures, tears, degenerative disc injuries, radiculopathies, we need to start moving away from philosophies, and we need to start moving towards evidence-based practice. So I think one of the biggest misconceptions that we have, especially orthopedic practitioners, general practitioners, neurologists, and even patients that have just maybe have a low tolerance for rubbish through social media. Mm-hmm. They look at us and they think that we kind of what the industry calls quacks, okay? Because it relates everything back to energy of the body. And I can understand where they're coming from, because chiropractic has various different, very different philosophies of practice. Each practitioner is practicing a different philosophy. So you're not going to get the same experience at different practitioners, right?
Yeah.
So I would say the biggest misconception is that we are quacks, but there's a lot of evidence involved in chiropractic. There's continuous research that is being published. If you want to check out research, go to PubMed, type in chiropractic and manipulation, and have a look at some of the research that's out there. Chiropractic has been shown to be more effective than medical care. It's been shown to be more effective when compared to physiotherapy and medical care. It's been shown to be more cost effective in the long run compared to medical care and physiotherapy. And then when you start talking about spinal pathology, there's a lot of research which shows that it's effective in treating neck pain, headaches, disc injuries, etc. Degenerative disc, managing spinal stenosis. So, you just need to find the right chiropractor, I think, for your specific problem. Yeah.
I couldn't agree more, because I preach about you to literally everybody who I come into contact with. And lots of them are like, oh, I don't know, I've seen a chiro before, and I've seen an osteopath before, and I've been here before, and it doesn't work, and this, that, and the other. And I'm like, well, that's not the experience I had. So I do agree that I think sometimes you have to find the right doctor or the right practitioner or the right clinic. I know sometimes cost comes into it, and I know that's going to be touched on later on as well. So that's quite hard when you're trying to find the right person, and every time you go to somebody it's costing more and more money. You don't feel like you're getting anywhere. Mm-hmm. I understand. But if you're in Dubai, this is the right one. Anyway, okay, so that's demystifying. Another thing that I've heard, or maybe it's something that I've also thought myself, is that it can be quite dangerous in the sense that when you're doing the neck manipulation, if it can go wrong, it can be catastrophic, horrendous, yeah?
So,
and I think a lot of people are scared of that.
Yes.
Especially with all these Instagram reels of I forward them to you all the time.
Yeah.
People just cracking plasterboard and taking the pee out of chiropractors. There's obviously a lot more that goes into it than just slamming people onto the bed. And that's how you make sure you're doing it properly, right? So
Yes.
let's just touch on that.
Yeah, I think the biggest issue in recent time, especially in the last 3 to 5 years, has been reported incidents of stroke, of patients experiencing stroke post chiropractic manipulation. When I was at uni, I think around 2014, 2015, we were covering this topic of stroke, and the research coming out at that time was that most of those patients already were predisposed to stroke, okay? And the chiropractic manipulation was kind of incidental. There would have been no effect, or the stroke would have rather the stroke would have happened even if they hadn't been.
Regardless.
Yeah, regardless, you know, after they go for angiograms and stuff, they see multiple blockages in these patients. But the current research coming out is actually more intricate. There's research being conducted on cadavers, and basically there was a recent study published that shows that the amount of tension brought about in a manipulation is not enough to create a dissection of an artery and to cause a stroke, okay? There's also more and more papers coming out that shows that chiropractic actually is not responsible for stroke. And we actually have a chiropractor based in Dubai who's an expert witness in several cases that have occurred in Europe. And he's testified basically based on the evidence that, you know, it's actually not the case. Chiropractic was, yes. However, I do think that, like in every profession, you have irresponsible practitioners.
Yeah.
You know, I once had a practitioner who he asked me to treat him, and I started off with a neurologic examination, and he said, "Do you always do a neurologic examination?" And I said, "Yeah, what about you?" He's like, "No, only if a patient says that they're having neurologic symptoms." Now, sometimes the patient can be presenting with a neurologic case, but not manifesting with those symptoms.
Yeah.
So you won't know unless you examine them, right?
Yeah.
In very much the same way, practitioners tend to go ahead and manipulate patients that are experiencing high blood pressure. Or let's start off here, they don't take a good case history. So they don't know that the patient has high blood pressure, is taking cholesterol medication, has heart disease, okay? Then they don't check their blood pressure because they didn't do the case history, you know? And then they go ahead and manipulate them. And because of, you know, we spoke earlier about the quacks in the industry, there's basically no research to show, or the research is very iffy on the effects of chiropractic on blood pressure. Okay. As far as I'm aware, once your blood pressure reaches a pre-hypertensive state, which is basically 140 over, I think it's supposed to be 120 over 80. Once it gets to 130, I think it's pre-hypertensive, 130 over 85, 90. Once it reaches that stage, you can't manipulate a patient. Yeah. Okay, because there's increased risk for stroke.
So this is a question that actually came in.
Yeah.
We've obviously answered it already. Are there any health conditions that a client could come to you with, and therefore that could affect the amount of treatment that you can give them? So high blood pressure. I know I've sent somebody to you before, and this somebody had an issue in her glutes, and she came to you and she had high blood pressure, and therefore you couldn't do manipulation.
I don't know.
She also had a problem in her elbow.
It was a problem with their elbow.
Not saying
there
names.
we go. Yes.
Trying not to say names.
There we go. Yeah.
But she had high blood pressure, and therefore I know you couldn't manipulate her. And that was a question that came in earlier today.
It's the same also with older people. Like, unless you X-ray that person before you manipulate them, you won't know if they have like a calcific aorta. So if you're doing a lumbar adjustment, a lumbar roll adjustment on a patient where you cross their leg over and you drop. In an older patient, calcific aortic or aortas commonly occur in older people. It's like having an artery in the brain that has atherosclerosis, and all your deposits of cholesterol in it. Okay, similar type of thing in the aorta. You can dissect that aorta, create an aneurysm, and that person can die. So you've got to be aware, and that's why, my sessions are 45 minutes because it takes me 20 minutes to do my case history.
Yeah, exactly.
I want to be thorough. After I'm done with that, I'm pretty sure I know what the issue is.
Yeah.
I'm just going to confirm with my examination.
Yeah, and I can vouch for that obviously you have all my history as well,
Yes.
and every time I come in, you check on the computer, and then we go through all the questions and things like that. So yeah, that's really interesting. Okay, thank you. Specifically for women, now there was a couple of things
Yes.
that you wanted to talk about. So we're going to talk about chiropractic care for women because that's obviously my market of who I mostly work with. Although I have coached men, would coach men, have nothing against it, I just generally am more pitched. And I talk all the time about menopause, menstrual cycles, periods, motherhood, pelvic floors,
Yes,
all of these things. And I know they're things that you want to discuss. So let's just have a quick, what specific care do you have to give to women who are bleeding in their menstrual cycle or menopausal? So when their estrogen and progesterone levels are dropping, and maybe they have osteoporosis or arthritis and things like that. Or women who have just given birth, maybe their pelvis and their pelvic floor and everything's kind of changed and out of shape. Changed position rather. Over to you.
Okay, so it's a good question. I want to state categorically, I'm not a women's health specialist, okay? I actually, because of the style of chiropractic that I practice, I don't see many women coming to me with a specific issue and asking me to rectify it using chiropractic care. I do know that there are chiropractors in Dubai who kind of work in this space. The two most common issues that I would see a patient for is if they come in with lower back pain, in particular lower back pain due to menstruation, and then lower back pain during pregnancy. I actually try and avoid treating pregnant women because there's a lot of factors that need to be taken into consideration. The trimesters of pregnancy, some type of manipulations are contraindicated, and then in terms of techniques, there are different techniques that different practitioners use or the specialists use in managing these patients, which I don't have training in. So I try to avoid it as much as possible. In fact, I generally manage females with lower back pain for the first trimester. And then maybe a little bit into the second trimester. And then I move them on to someone
which is the right thing to do.
Who's more equipped to manage those patients. And they ask me a lot of the time, can you see me? I'm like,
I'd rather not.
Yeah.
No, that's right. That's good for you. So let's move into menstrual cycle.
Yes.
You're touching on the fact that some women get quite severe back pain when they are bleeding.
Yes.
Or perhaps the week before they bleed as they're building into their period. Personally, thank the Lord, I don't suffer that badly with my PMS, premenstrual symptoms. However, I know my cousin from the age of 14, as soon as she started her menstrual cycle, was off school like every month with a hot water bottle, taking ibuprofen, like horrendous back pain. My mum suffers she's menopausal now, but did suffer. I remember it vividly, like every month, how bad she would suffer. So what can you do for women who have this PMS back pain symptom? Over to you.
Yeah, look, again, I'm practicing now for almost, next year will be 10 years. I don't think I've seen a single woman that's come to me in particular, but I've been in the clinical environment where people have been treating them. So I'm purely going to address this from a logical standpoint.
A general point of view. Yeah, that's fine.
When you start building up into menses, it's not just a hormonal thing that's going on, but physiologically there's something going on, right? So as you build up into your menstrual cycle, you're also going to start to have a change in your musculature, your pelvic floor, your core, and as things start to get tight, you're also going to have tightening up of your joints. So generally chiropractors do is, of course, during menses, it's a little bit difficult to get into areas like the abdomen or groin, but very gently they may work on releasing things like the psoas, or may release things like the paraspinal muscles, the quadratus lumborum, the gluteal muscles, just ease some tension. And then
so we're talking all this area.
Yes.
Because you're doing doctor language again.
Yes,
which
yes,
is
there we
great,
go,
and
there
it's
we
fine.
go.
But I'm going to translate
Yes.
for the audience. So we're talking like all of this region here.
Correct.
Abdomen, lower back area, glutes, hips, pelvis, groin.
Yes.
There to there.
I mean, I treat a lot of females. Most females will message me and be like, I'm on my menses, or I'm building up. I don't feel comfortable coming in, so they don't come in anyway. So but
although they don't feel comfortable coming in during their menstrual cycle or in the build up to it, maybe it would do them good to come in.
I think certainly if they're having pain, I don't think there's a direct, and I haven't seen any literature to show a direct correlation between chiropractic and menstrual cycle. I have to state that now because there are people who will be out there.
And I'm going to be on my laptop all night.
But I think that it's the therapeutic touch which has the biggest effect, Soothing someone in pain, soothing someone's sore and aching muscles when they're in pain is absolutely amazing, Releasing the joints, absolutely amazing. Chiropractic manipulation helps to reduce pain, improve muscle function, and reduce tightness in muscle. So if you can address that from two aspects, some muscle release and then some manipulation, I think it really helps people.
I think that's that topic covered. So let's talk about chiropractic care for athletes. Obviously, I'm an athlete. Obviously, I'm a woman as well, if you didn't know that. I mean, it might be questioned by some of you.
Yeah, you could just be identified.
I'm too strong. Anyway, don't divert. So chiropractic care for athletes, in the sense that we've discussed this a lot with me as well, and it can be a bit frustrating how lots of athletes, amateur and pro, kind of quite a broad topic here, will only come and see the chiropractor or the physio or the massage therapist when they're injured. However, coming to see during a maintenance phase checkup, not necessarily weekly, not even fortnightly, maybe once every 6 weeks. If you're on like a 12-week prep, you have no niggles, no symptoms, no specific injury, but maybe if you're doing a 12-week prep into quite a big comp, would it be worth coming in 6 weeks, like halfway through? Yeah. Maybe post-comp, especially maybe more so for strong women, or strong man, strong woman, because of the amount of impact and force that your body is under when competing. Physical stress, but also mental and energy flow stress. I know that I put an awful lot of mental pressure on myself during comp, and when I can come to you after a competition and kind of decompress and have some time out, that's also really important. Anyway, over to you. So what are your recommendations for athletes? And we're not just talking strong man, strong woman, we're talking
across the board.
Yeah.
Man, where do I even start?
I know, I'm sorry, it's a massive question.
I think the first thing that needs to happen is the athlete needs to be prepared, or need to want to, because you can't force people to come in, right?
You can take a horse to water, but you can't make it drink. I give your number out almost daily. If they don't want to make the call and they don't want to come in, halas,
that's
finish.
it. So I have a very small group of athletes, including yourself, that actually make it like a mandatory thing, and how it basically starts with us is Scarlett would message me, or like Bader Samreen, who's a boxer of mine, or that I help treat. He'll message me and he'll be like, listen, I have a fight on this date. I'm starting camp at this date. Generally camp for him is about 8 to 12 weeks out, so out of the fight. So we'll get him in, we'll assess him, and then we'll put together a plan. Okay, we're going to see you at week intervals over the course of the next 8 to 12 weeks or so. Or initially what we'll do is we'll assess him and we'll be like, okay, how are you feeling? What's going on? We'll look at the case history from our file and see what injuries we had in the past. We'll assess those areas of potential weakness. you know, and see if we can find anything there that needs to be treated. And then we may start with one session every 2 weeks. And as we build up to the deload phase of the camp just before the event, we'll probably go once a week, you know. And most of the time during camp, no one's coming in with any major injuries. I mean, we had one with you, I think, the deadlift.
Yes.
Yeah. But besides that, and I think
the sandbag on the head.
Yeah. Besides that, I think if we stick to a good plan, no one's coming in with injuries during camp, and that's what you want.
Of course, yeah.
Yeah, and then out of camp, I think again it's up to the athlete. You know, I don't force people to come in. You know, I would drop messages, and you know, check how people are doing. We're obviously all on social media, so I'm looking at what the athletes are doing, and I'll just be like, hey, how are you doing? What's going on? But out of camp, it's purely up to them. For me, I think that with my treatment, I encourage movement and exercise rehab more than just doing this. So if an athlete had to come into me with an injury on that specific day and it was out of camp, based on what the injury is, then we'll decide if we're going to do multiple sessions or we're just going to stick to movement, exercise rehab, and monitor them moving forward. I truly put the ball in the athlete's court, you know?
Yeah. So on that, I did a little, we'll add this in somewhere, maybe intro, outro. I did a little tour earlier of the clinic.
Nice. Okay.
And I took the video down to the gym.
Yes.
Which is obviously, we've been down to the gym and
Yes.
you've shown me lots of movements before. In some of my workout vlogs, I've also started by saying, I'm going to start with a warm-up, and this exercise was given to me by you or by Ashley, my sports massage, or by so-and-so. So there's lots of things in there that not necessarily we're doing in this room here, but that we're doing in the gym downstairs, or that you then show me and I take away and go through them daily at home or things like that. So chiropractic care for athletes is not just injury based. No. However, if you've had an injury and you want to come in and learn some rehab exercises or things like that, it's amazing, right?
I think today's session with you is probably epitomizes chiropractic for athletes. You know, you got to read your body. That's the most important thing. Is I try to educate athletes on how to identify the feeling that something's going to happen.
Yeah.
You know, because lots of the time people are just so ignorant to it that they just can't prevent it. Whereas Scarlett, obviously, you felt a certain way, and you came
very in tune with my body.
Exactly.
Yeah.
And that's what I try to encourage, not just for athletes, for all my clients. Be in tune with your body. Listen to your body. Your body will tell you what it needs and when it needs it.
Yeah, exactly. And I think it takes time.
It does.
I think being in tune with your body is a skill that has to be practiced. Where sometimes you might be a bit, I think the word is hypochondriac, where you kind of react too soon.
Yes.
Oh my God, so this might be really bad. But you learn what your body can cope with and how long it takes to get over different things like muscle soreness and things like that. Obviously, I work with Ashley, the sports masseuse, and she generally kind of keeps on top of most of my weekly DOMs and stuff, whatever. But yeah, and then other times I think perhaps the opposite to hypochondriac, I don't know what the word is, but you could leave it too long and maybe have a really high pain threshold and think, no, I'm all right,
Exactly.
I'll get over it. And it will just take one more lift or one more weight or one more kick or punch or whatever, and it could be almost game over. So it takes a lot of practice to just be so in tune with your body. And I think because I'm so religious about my sleep, my food, my routine, I train on the same days every week. I do the same program every, like, Tuesday's deadlift day, Thursday's pressing day, Saturday's events day. I know how long it takes me to recover from deadlift day, and I know how long I should feel after pressing day. It's not like, oh, I'll do pressing day on a Saturday this week and a Monday next week, and everything is so routine that I know the minute something is out of whack.
That's it.
I do like spontaneity in my life, believe it or not. I like routine, but that leaves me space to be spontaneous. God, I've got no words today. Spontaneous in other areas of my life, which is really nice, because I know that I've ticked all my boxes in other areas. Anyway, we're going to get to the fun bit. I put a little question box on my Instagram story today, basically to say I was coming to meet you.
Yes.
We're going to have a chit chat. We kind of covered a few questions anyway. This question, I'm not going to name names, but the person will know who they are, has come from a fellow competitor of mine who I'm against. She lives in the UK. She's very good. She beats me every competition. Damn. One day I'll get her. Anyway, she said, herniated discs, when to seek manual therapy or do I consider surgery?
Whew. That's a nice question.
This is not, you don't know the context of this condition. I know a little bit more about it, but...
Yeah, I think there is a standard approach. There's a gold standard of management of disc injuries. Let's change the question around a little bit.
Okay.
When to seek manual therapy, when to seek surgery. Let's talk about when surgery indicated. That will answer the question of manual therapy, right?
Okay.
Most times surgery is proposed by orthopedic surgeons because the patient's in pain.
Yeah.
And when they do a scan, they find a presence of a disc injury. So purely based on those two reasons, patients...
MRI scan.
Yes.
And the pain level.
And the pain. Patients undergo surgery, right? I think that the time frame between pain and MRI, in that time frame, patients obviously go to seek manual therapy with people, and it fails, and then they go to the surgeon who proposes the MRI. But a lot of the time it fails because I believe that the diagnostic workup is not appropriate. Okay, so they go for the MRI, they propose surgery, they get it done. But those two things alone are not indications for surgery. We got to start with the case history, how you're presenting, right? Morning stiffness that is debilitating, preventing you from getting up, getting out of bed, doing your ablutions, etc. Night pain that's preventing you from sleeping, okay? Bladder and bowel dysfunction, that's a big one, okay? Especially if you're having a lower back disc injury. Okay. What else? Essentially, pain is not an indicator unless it's debilitating. So if you can't live your everyday life, that you just can't live at all. You can't go to work. You can't provide for yourself. That's an indicator. Okay. Then we go into physical examination. There are some other factors. I'm just going to keep it very general, right? Then we go into physical examination. Sensory loss, where you can't feel, motor deficit, where you're finding it difficult to engage your foot or you're finding it difficult to grip something. Reflexes, you have absent reflexes, which tells us that there's a dysfunction within the nervous system. Positive nerve root compression tests, then we look at treatment, all right? Failure of a treatment and or exercise rehabilitation program, which is very important because a lot of the time treatment and exercise gets prescribed
and it's not done, and then people think it's failed, but they haven't actually been doing it properly.
Or the treatment and exercise prescribed is not specific for that injury. So if you answer no to most of those things that I mentioned, you probably don't need a surgery. If you answered yes, you probably do. But there are other options. Epidural injections, selective nerve root blocks. There are options for you out there. You got to get a second opinion. You got to speak to people that know, the little tricks of the trade, because not every orthopedic surgeon recommends injections because they don't make any money on injections.
Interesting point. If my partner was here, Mr. Scarlett would be bang on this subject because he's a businessman and he'll be like, no one does anything unless they're making money out of it.
There you go.
Doctors included. So you think you're going to a healthcare professional to get the support and the advice needed, and actually they'll only do what makes them money. And I know this is very general speaking. Also, I know people in the UK are mostly on the NHS system, so it might be a little bit different compared to we're out here on private healthcare system. Again, so things work a little bit different through insurance and stuff like that. I'll leave that topic there because I don't want to touch people's, make people a bit grouchy. Anyway, let's move on. Somebody asked, what do I wear to the appointment?
Clothes.
So I've just had a session before we did this chat. This is what I'm wearing. Sometimes I have turned up in leggings and we've been looking at my hip or my glute, and you've given me a pair of shorts and asked me to get changed. Other times you've given me a
gown,
a gown, like a blue papery type gown. So just wear clothes and we'll figure it out when you get here.
Yeah, but please wear underwear. It's very important that you wear underwear. I don't know what it is, but people don't like wearing underwear when they come
So you've had patients turn up.
Yeah, people laugh at me when I ask them to undress, and I say, before you undress, do you have underwear on?
Is that real?
That's a real thing. And it's not just guys, it's women as well.
Okay, men and women.
Men and women.
Okay, this is so weird. I don't even know how to move on from this subject. Okay, next question.
Yes.
If you have a client who is in menopause, do you treat them differently? Kind of touches back on what we were talking about earlier.
I think that because of the hormonal issues that are going on, sometimes patients come in maybe highly strung. Again, it's not too much of my area, but that's something that I've noticed, maybe highly strung, stressed. Their blood pressure is high, they're feeling hot, so it
could be a multiple array of symptoms.
The only thing that I do is, patients that you've referred to me and you who have seen me, I talk a lot to people, I just make everyone chill, calm down, have a little bit of a laugh,
case history again, we're looking way back at case history. So you would treat somebody in menopause the same as you would treat anybody else, in essence of you would learn their case history first and then go about
medication. Basically just the only thing is that it's called a yellow flag when patients come in and they're just a little bit highly strung. That's all that I have noted. And if a patient is experiencing menopausal symptoms and they're not really sure how to manage it, or they're not even aware that it's a menopausal symptom, what I try to do is direct them accordingly.
So that could be more perimenopausal, as things are just starting to change, and maybe they're unaware that this is the stage of life that they're going through.
Yes.
And actually coming to see you and you redirecting them.
Yeah, so I'll give you an example. Like if obviously a woman comes into me and maybe she's in her, obviously you could get early onset menopause, but let's just say the quintessential, the quintessential case. Maybe she's in her middle to late 40s or early 50s or something, and she's coming in with neck pain, but she's also complaining of feeling hot all the time. That's generally the type of patient that I would see, and she'll say to me, can this neck pain make me feel so hot and flustered? Then I'd be like, okay, listen, are you going through menopause, or are you premenopausal? When's the last time you saw your gynecologist? That type of stuff. And
are you aware of menopausal symptoms?
Yes,
Do you know that these are a bit of a crossover?
Yeah.
Exactly. Cool. Okay, let's move on from that. Next question, does it hurt?
I mean...
Are you redirecting that at me, are you?
No, you know why? Because it was... our session was perfect, because I explained during that session that I was doing the soft tissue to make the adjustment much easier. Once had a doctor who asked me where I was writing my clinic notes, and he said, you're not going to do some soft tissue on this patient? It was when I was in clinic, and I said no. He's like, when you get adjusted, do you prefer a hard adjustment or soft adjustment? I said soft. He said, right, go do some soft tissue, then manipulate the patient. So we always want to make it comfortable. I think it hurts when a patient starts to tighten up, and you as a doctor need to use a little bit more force to get the manipulation done. Or you have a joint that is really, really jammed and you can't get it moving. Maybe you need to use a little bit more speed. Maybe you need to use a little bit more force. But other than that, it's like butter.
Yeah. Okay, no, I agree. It's never hurt me, but I do think I'm very good at using my breath work. You might have even heard in that last video, I'm like... because every time I breathe out, not even in the manipulation, the soft tissue work and everything, using your breath to help just relax the body, relax the mind, relax the nervous system, the muscular system, and everything like that. Okay, let's move on. Why is it so expensive and not covered by insurance?
Good question. So chiropractic is expensive in Dubai, but it's relative. Okay, everything is expensive in Dubai. It's not related specifically to us. It also stems from rent,
Cost of living,
all that type of stuff. Okay, so yes, it's expensive, but it's a little bit more affordable in other places of the world. I speak for South Africa, and I know when patients come from the UK to Dubai, they talk about it being £50 to go to the chiropractor. I don't know what that is in dirhams.
250 dirham.
Okay, yeah, but it's relative to where you are and how many chiropractors you have. In South Africa, we 800 chiropractors. Here, we only about 80. Okay, so the second thing is, why doesn't insurance cover it? This is again a specific issue with Dubai. If that person was from Dubai, unfortunately that's an issue that's here. I don't want to get into it now. I'll be here talking for days, but that's a specific issue here. In most countries it is quite well covered, you know.
Some insurances do cover this, some don't.
It depends on the plan that you're on, the insurance that you're on, the tier that you're on, the network that you're on, all of that fun stuff.
Yeah, let's not go there. Okay. Does yoke training impact the spine negatively? So this is a strong man, strong woman specific question. We're talking about yoke training, which is where you have the big frame that goes on the back or the shoulders, however you want to hold it. I have been in to see you post yoke training, and after winning at Brits, where I did the 220 kilo super yoke, I was straight in here because I was like this. So does it impact the spine negatively? That's not really about your practice. That's more a training question.
It's a difficult one. I think when you're lifting, you're going to have some overload on the spine. I can't tell you to what degree it's going to be negative. I think whenever we're lifting, we're going to overload the spine, right?
Person specific, ability, level,
load,
all that type, volume.
All of that stuff is going to have an effect on it. You know, you can be someone like Jay Cutler, who is pretty much injury free, and then you can be someone like Ronnie Coleman, who is another story altogether.
Agreed. Okay, so how to train around scoliosis?
Okay.
I know this is a big question. I know this has been on quite a while now, so I'm just kind of time checking. But how to train around scoliosis, if you can, general?
I think most importantly, you need an updated X-ray to identify structural changes in your anatomy. You need to know where the scoliosis is. Is it lumbar? Is it thoracolumbar? Is it thoracic? So mid-back, between mid and lower back, or lower back. And then based on that, you need to put together a exercise rehab protocol. I actually had 2 patients today that have come in with scoliosis, and neither of them is doing any rehab. Most patients with scoliosis can live normally without any major issues, but if you are training, you got to constantly be working rehab that's specific to how your scoliosis is curved.
So again, person to person situation, needing to assess the spine, and then put in a rehab plan specific.
Correct.
Like I should do mostly 90% I do start my sessions with my rehab program, and then I go about my session. Like that. Another person with an injury, there's parts to this. So how do you split your workout routine when doing rehab? More detail. Like you don't have a lot of time to go to the gym, let's say an hour a day. So do you either do the rehab or do the workout? And how many days would you work out versus how many days would you rehab? So this person, a guy, obviously has an injury, has a rehab program to do, still wants to go and train. How does he handle that?
Yeah, very interesting question. This is the way I split my rehab when I have an injury, or if I feel like I'm getting a niggle and I need to work on something. The way CrossFit structures their workouts.
He just got it.
The way CrossFit structures their workouts is how I structure my workout. So we normally will call it pre-drinks, and then drinks and a nightcap. Okay, so your pre-drinks would be your warm-up to your main workout.
Training session.
And yes, your main training session. And then your nightcap would be like a sort of cool down, easier type of session after the big workout. So that's what I do. I reduce the time frame of my workout to accommodate my rehab. and I create a sort of HIT circuit type system for my rehab. So I use Tabata timer, and then I just put on, maybe I do 3 to 5 exercises.
Yeah.
I put it on a 10-second timer with like maybe 3 to 5 seconds to switch between exercises.
Yeah.
And then I either do it for time or reps.
Okay.
And then I move. And then I do maybe 3 rounds, and that's my rehab done.
Yeah, okay. So, and you would use that as a warm-up pre-drinks to your drink session?
Yes.
Perfect. There you go, if you're watching. Okay, so I've got lots more questions to go. I'm gonna stick to 3 of them, and 2 of them kind of cover the same subject. But before we go into that, if you haven't already, subscribe to my channel. Please like the video. Drop any more comments, questions below, and if we haven't covered anything in this chat, which we've covered quite a lot,
yes,
and you want to ask the question, please do, and then I can get you to answer the questions.
Yeah, for sure.
Or I can try and answer questions. We'll see how that goes. Anyway, so this question is from a doctor, friend of mine.
Okay.
She's a GP. Says, something I'm super interested in is how does weight training affect the risk of shrinking as we get older with the pressure of the vertebrae with the weights loaded on your spine?
Sure, that's a good question. I actually haven't seen any research to show the effect of weight training on disc height over a period of time. That would be a significantly long research study because you'd have to work with someone or assess them, do an MRI, and then
wait till they get really old.
Yeah, you know. But I'm going to use logic on this one because I see a lot of patients that come in with degenerative disc disease.
Yeah.
I don't know if it's specifically weight training because I see a lot of guys that do weights train that don't have that bad degenerative disc. Then I see people that don't train that have really bad degenerative disc disease, and you actually see how they've changed in size or height.
Not training will make you shrink.
I think so. I think the most important, with the research coming out now, we're seeing more and more often that you are being encouraged, especially in men and women with menopause, I'm sure, we're being encouraged to weight train.
Yeah.
Yeah, so if anything, I think it's going to help you to stand up tall, be strong, and have less tension on your discs that will affect degenerative disc disease, dehydration of the discs, etc.
I couldn't agree more, to be honest. I think loading the bones is what makes them stronger.
Yeah.
And by not loading them, i.e. not training, is what causes them to get weaker, brittle, and squished.
Yeah.
And if weight training is going to make me shrink, I'm fucked. Because I'm really short already.
Well, even if we look at the older weight lifters, like if you look at Arnold or Lee Haney, they're pretty good, you know. Arnold's not hunched over and bent over, but
no, he still looks great
exactly,
in his recent documentary,
even Sylvester
interesting
Stallone.
Comparing men and women, though.
Yes.
With the whole menopausal thing again.
Correct.
I do think women's bones deteriorate or degenerate faster than men's anyway. But in relation to weight training, no research to refer to, but we're saying no.
Before anyone says that I'm discriminating against women, I can't think of a woman bodybuilder or Scarlett's the strong woman. We'll have to assess her spine in 30 years from now.
Stay tuned. Anyway, okay, so I've got 2 more questions and then we'll wrap this up. One question has come from an absolute boss babe of mine, corporate killer in her industry. How often should someone with a sedentary desk job, but also weight trains 3 times a week with me, see a chiropractor, and why? Hold on. Another question from a PT colleague / friend saying, maybe understanding seating positions and posture for corporate route and the importance of back stretches. So we're kind of like talking about the corporate life.
Yes.
People with sedentary jobs sitting at a desk all day long. The boss girl said, how often should she see a chiropractor and why?
Okay. So even though chiropractic is my livelihood, you don't need to see me. Okay. I want to make that very clear. The reason is because I can't fix your posture.
Yep.
Okay? And the most I can do is relieve some tension, stimulate your postural muscles, and improve your mobility. But to maintain it, you got to do that on your own. So how many times you need to see me? Hopefully only 1 or 2 times.
Yeah.
Moving on from there, you've got to work on your spinal mobility. You've got to work on activating your postural muscles, and
Which
just doing that.
They do through weight training 3 times a week.
Yes, but I think that what we're looking at specifically with people that are working a desk job is we need some targeted exercises to engage the trapman, the trap meet, the rhomboids, maybe the core in a different way other than just lifting. So maybe some specific rehabilitative exercises for that type of work, you know?
Interesting.
Yeah.
Okay, that was really great.
Yeah, and there was a second part to that question, understanding seating posture.
Yes,
or
seating posture.
position.
So obviously we're talking, I know for sure, you can see that I sit
Yes.
really weird like this. Also, I drive my car with the foot up.
Yeah.
And I always sit with the leg up, and when I'm on the sofa I always have a leg up on the back of the chair because I actually can't sit. I find this really uncomfortable, but I see it all the time that people slouch in chairs,
Yes.
sit like this, drive like this. How do we address that?
So I think if you're working from home, the best thing to do is get a standing desk.
Yep.
Right? That's
Agreed.
the best thing. You got to invest standing desk and a good quality chair that you're going to be comfortable in. The third thing is you need to move after every 45 minutes to an hour. Right? That's the most important thing. Break your posture. And then the best sitting position, man, if you go to Google and type work ergonomics, you'll get an exact setup of how you should sit at your desk. But again, if you're working from home, it's better to use a standing desk. If you're working from the office, follow those work ergonomic guidelines that you see on Google. Break your posture, do your spinal mobility. That's the best advice that I can give.
Yeah, okay. Notice I feel like I'm sitting up straighter now. Obviously, when you're working in the office and you need to break the posture every 45 minutes to an hour, set an alarm on the phone. That would be my top
Yes,
tip
put
that
a
I've given
sticky
to
note
clients.
on your laptop screen or PC screen. Yeah.
Yeah, like a visual or sensory signal that says it's time to get up and move.
There we go.
Anyway, I'm going to leave. There are more questions. I feel bad that we didn't get to them, but that is quite a lot of information. I found that really interesting, really useful, especially this bit. I like this.
Yeah.
But also some of the questions and how you've addressed those. So I hope you guys enjoyed. Is there anything you'd like to add?
Not really. I mean, you guys please look out for me on social media. You can find me at Physique Chiropractic on Instagram, Dr. Ranen on TikTok, and Dr. Ranen Rambrij on YouTube.
TikTok is great, by the way.
Yes, TikTok is amazing.
Check him out on TikTok, Instagram, and YouTube. If you haven't already, subscribe to my channel. Please like the video, give us any comments. And that was episode 1 of me coming back to the podcast. I have a huge lineup of guests. Huge lineup for me, like my industry, my life, what I'm doing. So if you're interested, stay tuned because we're going to be touching with different people that I work with, that I talk to, that I have contact with on a weekly, daily basis. And I just hope it brings a bit of insight into other industries. I don't know, maybe if you're a youngster and you're looking into what career you want to do, maybe listening to this might be quite inspiring. As you spoke about how you got into it, I'm an ex-teacher and I know that this is a hot topic of career choices and things. Anyway, let's not just get distracted. We're wrapping the video up. I'll talk all night. See you later. Thanks for watching and see you in the next one.